Come to you, come to you. Okay, everyone, we're about to begin any second now. And I just need to have confirmation that you all are hearing me so that we can go ahead and get started. Welcome if you've not joined us before. Welcome to our patient health workshop for March 2022. And we are excited to have you here joining us. I'm also grateful to know that you will take the time out of your busy schedules to just spend some more time with me. I tell my patients all the time, well, not my patients, but my members of my team here, that I don't know if something is wrong with me or whatever, but I really don't get tired of my staff and I don't get tired of my patients. I truly enjoy spending time with you. Obviously, within reason, right? Because I do have to sleep as well and I have to share my time with my family. But I really enjoy every moment I get to spend with you. So I look forward to this evening. I hope it's a wonderful experience for you, and I hope that you enjoy the conversations that we will have. If it is that you have any questions that you would like for us to um, discuss, feel free to raise them because the whole purpose of us being here together is that we will be able to really enjoy each other's company as much as possible, right? So I'm really excited about it and I hope that you are as well. And we want it to be an interactive time. So please feel free to make a comment in the chat if you have a question, if there's something that I've said that you do not understand. Feel free to raise it. We just ask that everyone be respectful of everyone else and there's no negative comments about anybody's comments or anybody's suggestions because I want it to be a good fun space and a safe space for everyone. Um, we're about to begin. And I'd like to know for those of you who do not currently have um, if you do not currently have the downloaded file that I made available, the handout, I'm gonna put up that QR code one more time, and I've been looking at my messages to see if anybody is requesting access. I'm not seeing where anyone has requested access, so if you have tried scanning the QR code and it doesn't give you anything, please let me know. Here it is. There are few persons, so let me see how to do this. Yeah, share. Nope, not editor. So I'm making it available to you, those who requested it. All right. Give me a second here. Um, who is Very Bunny? If Very Bunny can identify yourself and let me know if you have access. If you do not have access, I need to know. So Very Bunny, please let me know if you have access. All right. So let me put up by the QR code real quick because I want to make sure that you all can get the handout and see the handout. So here it is, and I'll just remove my image from the screen so you can also see the link. And a beautiful and blessed evening to you as well, Lady Reed. And let me go back and check now, make sure everybody. All right, I'm looking here to see if there's anybody else. And if you want me to give you access, I'm gonna just ask that you please go ahead and just, if you can't, if you don't have a QR code, just send me your email address. Write your email address in the chat, and I will copy that email address and add you to the link and see if we can get that there, get you access without you having to scan the code. So I think that's better. Good. So I see that some others have tried logging in, and I changed the setting so you should be able to have access now. But if you do not have access, just let me know and I will try to grant it. So once we get started here, so let me just make sure. I'm getting there. All right. Okay, I think we're doing well. All right, so Garnetta, if you have an email address, let us know what it is, and I'll add you to it. All right, so let's just get this done here. A couple moments. We have a few persons with a handout that they can view it. Okay, so Nishi is good. Stokely is good. Let's see who else is waiting for access. Let's see. All right, Angela, send me your QR code as well, please. Not your QR code, your email address, sorry. Or better yet, all right, Barbara, haven't received it yet. Let me do this here. I'm gonna try to copy the link and just paste it in the chat, and all you have to do is um just paste it in your URL in your browser, and you should be able to get it. So that is the link. If you do not yet have it, just let us know. All right, let me just make sure I check on some settings here real quickly. All right, audio bitrate is set at that. Okay. All right. I think we should be good now, and just make sure for me, please, that you go ahead and add in your info. I Once I start the class, it's going to be hard for me to go back and add your email. This is so this is what the handout would look like. And so let's go from the beginning. All right. So let us begin. In the handout, um, we have different fill in the blankers, but I changed them to the actual words. So you'll be able to use these to assist you as we go through the class so that you know exactly what we're dealing with and you have something to look back on and hopefully remind you. And is somebody's not hearing? Let me just make sure. Yeah, we're having audio on our end. So please make sure, Emlyn, that you refresh your browser or you make sure that your audio is turned up. If anybody else is not hearing, I need to know. Um, Anyone else not hearing, please chime in because I don't want to get started. I was about to get started now, but since Emlyn says she's not hearing, I need to know. All right. Auntie Sheila, how are you? Long time, long time. Go right ahead and copy the link that I sent a little bit higher up. And Sheila, please press F5 to refresh your browser. You should be able to hear me. All right, let me make sure that Emily is hearing so I can get started. It's gonna be a fun little class, and hopefully it's meaningful, especially with the fact that you have the handouts now available. Once again, this is the QR code. So, all right. And anyone who wants the handout, please just go ahead and just click, just search through in the chats. I sent the link in the chat section, so you should be able to just search through in the chats where you'll see the link address to. In fact, let me just go ahead and pin that. So that way anyone can have access. Wow, what a late start. Please forgive me for the lateness because the main reason I think is because we were trying to get the links out to everyone. And so I have pinned the link at the top of the chat section, so you should be able to see it on the same page. Just look at the very top comment with a blue highlight, if you have a blue highlight on yours, depending on your settings, and you should be able to see that link. All right, so just click on that link and it should take you to our to the form. Keep that form open in a separate tab and you should be good to go. So the topic is 7 keys to getting and staying well. 7 keys to getting and staying well. And what we will do is go through each of them, and hopefully you are all able to understand what we're discussing and participate fully. It is my hope that you are raring and ready to go. I'm going to try to see if I can accelerate it a little bit because I don't want us to stay too much later. We should actually end at 7. For those who can't stay past that, you can always look back for us later on when you get home or if you're on the road and just download watch the class from your computers when you get a chance, because I'm going to leave it up. Good. F5 worked. Excellent, Emlyn. So anyone with any difficulties, just do that. Excellent. So let us begin, shall we? Now everybody's on target. And so let me just send a quick thing that everyone should press F5 now. So everyone, please press F5 on your laptops or refresh the YouTube page. To go live. We are beginning now. Perfect. So, 7 keys to getting and staying well. That's what the handout looks like. This is the QR code for the handout. But as I said before, if you want to access it, just look for the message at the top of the screen and click it. Well, Shift F5 for you. Great. I'm glad it worked out, Emlyn. Thank you so much for that. All right. So the first key is sick care versus healthcare. And if you have any questions, anything you do not understand, feel free to let me know. And if there's anything that you want to say as a comment to add to the body of the discussion, please feel free to do so in the comment section. If it is that you put any inappropriate comments or anything like that, I'm going to delete the comment and I'm going to block you from commenting again. So please don't do that. Let's keep it civil. Although I don't think there's anything really controversial that I shall say tonight, but the night's still young. So understanding that there is a difference between sick care and healthcare, whereby the current model of the healthcare system, or the system that we refer to as the healthcare system, is one where they focus on taking care of somebody who has an ailment. In other words, somebody has to be sick with some issue, have some disease, have some injury, something has to be wrong in order for the system to be of benefit to them. This is how the system is primarily designed. It is not the only function. Anything else would be secondary because it is not the primary way that the system is set up. And I think that's pretty self evident, right? And there's nothing wrong with that because at the end of the day, we will need somewhere to go when we are sick or when we have a disease, whether it's cancer or whatever. We need somewhere to go. But the problem with a sick care mentality or approach is that something has to go wrong first. And so, according to this model, I refer to it as a sick care model because it's caring for the sick. And caring for the sick always means that somebody has to get sick first, which means that the response is always after the fact. We call this a reactive approach. So sick care is reactive. But true healthcare, if you want true healthcare is proactive. And what do we mean by being proactive? By proactive, we simply mean doing something before something else happens, or doing something in anticipation that something else can happen so as to prevent it from happening. That is what we call being proactive. So if somebody's gonna step on your toe, proactively you can put on your shoes so that the impact is not so bad. Or proactively you can remove your foot so the impact is not so bad. So there are things that you do in anticipation of an action to prevent the action from occurring. Now, what many people are unaware of, we see what's happening now in Ukraine, in Russia, or with Russia and Ukraine, and all this craziness that's happening in our world. I know a lot of people are really concerned, as I am as well. But I believe that God, the same God that made us, He also sustains us. And so I'm not worried about what's happening in the world. I might be concerned, but I'm not worried because I know in whom I trust. But having said that, there is a crisis as it relates to healthcare. Many people are unaware, but there is a crisis. And this crisis is brought on because of a mismatch in what is wrong with somebody at the core and the treatment that is being applied to correct what is wrong. So at the core for everybody, the majority persons that are a part of the healthcare system right now, the main population of people who are in hospitals right now, they're not there because of gunshot wounds. They're not there because of an infection. They're certainly not there because of COVID. They are there because of some lifestyle choice that they made that led them down a path of illness. What are examples of these lifestyle choices? The things that you decide to eat, the things that you decide to do on a day-to-day basis, whether you are exercising or not exercising, whether you are having a sedentary lifestyle, whether you are eating whatever it is that you choose to eat. These are the choices that you make in life, and these are the choices that impact how likely it is that you will be a customer in the sick care industry. But the problem with the system as it exists today is that the main population of people who are there because of a lifestyle choice. But the main intervention that is given are twofold: drugs and surgery. And drugs and surgery cannot solve a lifestyle problem. And I repeat that one more time: drugs and surgery cannot solve a lifestyle problem. If your problem is what you're putting in your mouth, then the solution is to put something different in your mouth. If your problem is that you're not moving enough, then the solution is to move more. If the problem is that you are exposing yourself to a very heavy, polluted air, the air around you is very polluted, then the solution is remove yourself from the exposure. If you're exposed to toxic chemicals, remove yourself from the exposure to the toxic chemicals. Whatever is happening in your environment, you have to do the opposite to restore yourself to good health or to restore balance to your health. Drugs and surgery cannot be the solution. Amen? I hope that's clear. But we have a bigger problem. The problem is not even just what happens in hospitals, insofar as how doctors choose to treat. The problem is how people think. And I have many persons who come to see me at the office, and when they come in, they are of the mindset that, Dr. Gardner, I'm suffering with pain right now. Why not prescribe? Medical doctors prescribe medications, hence medical. They practice medicine, which is the practice of prescribing medications. I hope that's clear. I'm a chiropractor, specifically a chiropractic neurologist. And as a chiropractor, chiropractors belong to the complementary form of healthcare, which complements, not replaces, but complements medicine. And we do so in a way that does not involve drugs or surgeries. And so that is not the solution from me. So do not ask me to give you any medication. I cannot prescribe you medication. But the second reason I don't give medications is that medications do not fix problems with your health in general. There are some medications that actually do offer as close to a curative solution as possible. These medications may include an antibiotic if you have a bacterial infection, maybe an antiviral if you have a viral infection, maybe an antiparasitic if you have a parasitic infection. There are different drugs that can do different things to address the specific cause, but by and large, most drugs do not do that. Most drugs, for example, chemotherapy. People take chemotherapy because they have cancers. And they think that by taking chemotherapy, it's going to improve their chance of survival. Please ask the doctor if you are en route for chemo or you have already made an appointment or are talking to somebody about chemotherapy or they are suggesting that for you or a family member. Ask them, what is the percentage survival increase if I were to take chemotherapy versus not take chemotherapy? What is the percentage improvement in my odds of survival if I take chemo versus do not take chemo? Ask for what that percentage is. Because I think you'll be shocked to know that it is, I think, 3% or 2% improvement in odds. And I don't even know if that really is a significant or statistical improvement to count as an improvement. So chemotherapy offers very little, but everybody's of the opinion that it does because of the marketing done by the pharmaceutical industry. And so they believe that it is the best way. So I don't want to go too far down this rabbit hole because there are other things to discuss, right? But just suffice it to say that um, drugs do not solve our problems. There's another drug that is being offered as a solution to an infection problem that we're having in our world right now. And I'll say this one more time: drugs do not solve health problems, period. They might be of some benefit depending on what the drug is, but they are not the solution to our health problems. Um, Having said that, the solution that's being offered for the current situation of infection in this world right now is one whereby we do not even know what the long-term effects are because no long-term study has yet been completed. And when we say a long-term study is between 2 to 8 years at least in length to know that if you take this intervention now, what will happen to me 5 years later? It doesn't matter just to say that something offers a benefit to something else. And that's why the Hippocratic Oath says a couple things. It says, first, do no harm. So whatever the intervention is, the first thing that has to be considered is not even whether it is effective. It is first, do no harm. And so I'm shocked when I see my brothers and sisters who are in the healthcare profession pushing for something because of a perceived benefit in the short term without any data or information on long-term safety. First, do no harm, my brothers and sisters. It is our requirement. It is not just a nice thing to say. This is what we have sworn to do. First, do no harm. And if you, in good conscience, are able to recommend a health product that you yourself know has no long-term safety data, I don't know what to say, but I can't do it. And I know many of my colleagues, medical doctors around the world, have been voicing that they themselves can't do it because the data is not in. We don't know whether it's going to cause cancer. We do not know whether it's going to cause anything. And as Jai was saying, or Jay, I'm not sure if I'm pronouncing it correctly, but 2 to 8 years is still medium term, and that is true. There are many drugs that takes 20 years. I'll give you something to think about. If the process that leads to cancer begins in your body today, right now, right this moment, this very second, do you know how long before that process that led to cancer that started today will be able to be detected by the most sensitive equipment that we have right now to measure cancer? Do you know how long it will take before that test can come back positive that you have cancer? How long do you think? If it starts today, how long do you think? Cancer cells take 10 to 15 years before it becomes detectable. So by the time you find out that you are positive for cancer, you've had the cells there for 10 to 15 years. And this is why we do pap smears. Because with pap smears, they're not looking for cancer. They're looking for the abnormal cells that may become cancerous to try to prevent the cancer from developing in the first place. And that's a beautiful thing. I love the pap smear as a test. It's a wonderful, wonderful test, and it saves so many lives. But there's another test I detest, and that is the mammogram. I detest that test. And this is not just me personally, but because of the data. And if you think about it logically, breast tissue is highly mutable. if it were, um, it can change. The cells are very susceptible to changes. Changes that can be as a result of toxins in your environment or as a result of radiation or some toxic exposure. This is why breast cancer is such a prevalent thing for both men and women. Prostate cancer is a different scenario for that, but for breast cancer, um, easy for those cells to change. Why would you recommend that you put radiation, X-ray, because mammograms are X-rays, but not just X-rays, they are low-level X-rays, through breast tissue that you know are subject to changes due to radiation exposure, which can become cancerous later on as a result of the radiation exposure. This is why we don't do X-rays on everybody all the time. We have to do a certain amount because there's a therapeutic dose for which it is okay to do it. But if you continue to do that over and over again, you're building up the exposure within the person, and the accumulation of these exposures are not just additive, but they multiply not quite at an exponential level, but they do add to each other. Why would you expose breast tissue to X-rays, low-level X-rays, over several years? And I know some persons will say, well, at least it's not high-level X-rays. Let me explain something to you. X-rays occur in a range. There's a band within which, of frequencies, within which it's considered to be an X-ray. Just like visible light. Visible light is a range from red to violet. Anything below red you cannot see, anything above violet you cannot see. So anything infrared is below red, you cannot see that. Anything ultraviolet, above violet, you can't see that. That's where those words came from. So red to violet is the visible range for humans. Then X-ray is on the same electromagnetic spectrum as light, as visible light, but it's a higher frequency. It's a frequency that we cannot see, but it's also a range. And on that range, you have low-level X-rays and higher intensity X-rays and mid-range X-rays. Well, the higher the intensity of the X-ray is, the greater its ability to penetrate things. The lower the level is the lower its ability to penetrate. So the problem with low energy X-rays is that its ability to penetrate the human tissue is not very good. And that's why they use it, because it's only when something absorbs the X-ray that you can see it on an X-ray film. If the X-ray goes straight through it, you will not see what the X-ray goes through. You only see what stops the X-ray. And if you use a higher level X-ray, like what you'd use for bones when you're doing an X-ray of your spine, for example, they use a higher energy X-ray because they are only interested in the bones primarily. And so the intensity of those X-ray beams go through all of the muscles and the tissues of the body and are stopped only by the bones. And so you only see the bones. If you use low energy X-rays, that means the X-rays are being stopped within the breast tissue. It is X-rays that are absorbed by the body that will cause what is called ionization of the cells. Ionization is turning an atom into an ion by kicking off an electron. This is how an X-ray causes damage to cells, by ionizing the cells. That's why X-rays are considered to be ionizing radiation. Lower level X-rays have a higher probability of creating ionizing radiation in human tissue. Why would you put low-level X-rays to breast tissue that potentially could become cancerous? And so there is one thought that is very prevalent, and there are different people on both sides of the spectrum. There is a benefit to mammograms. Do not get me wrong, there is a benefit, but there's also harm in it. And so, as I indicated before, my mantra, first do no harm. Women are required or encouraged to do mammograms repeatedly for the rest of their lives until they're in their 70s or 80s, or whatever the age is where they say the risk of breast cancer is so low you don't need to do it anymore. The school of thought is this, that, and there's a question that is asked of mammograms, and the question that is asked of mammograms is this: do mammograms cause more breast cancer than it detects? That is the question that is not properly answered to this day. Do mammograms cause more breast cancer than it detects? And because we have other means of assessing to see whether or not somebody could potentially have breast cancer, why are we still using mammograms? Why are we still doing that? Yes, it's easy. Yes, it's cheap. But there's a burden, there's a cost down the road. Why not just use ultrasounds and MRIs? Why is it that a woman cannot just go in and get a routine MRI of her breasts, where an MRI is just a magnetic field, not ionizing radiation, just a magnetic field that gives you better imaging of the breast tissue? Yes, it's more expensive. Yes, if you don't have insurance, it will cost a little bit more. But why take the chance with mammograms? So that is, you know, wow, I've spent a lot on this. I've never talked about this so much. I've never talked about this so much. Um, well, Daniel was asking about doing two X-rays a few months apart. Like I said before, if it's like an X-ray of your spine, it's a higher level, higher intensity X-ray beam that just shoots right through your tissues, and so it doesn't create the risk of ionizing injury as does lower energy X-rays. So if you did X-rays of your spine, X-rays of your chest, X-rays of your most of those other types of X-rays, it's not usually as dangerous. The ones that have a little bit more danger to them would be dental X-rays and mammograms, because those are lower level energy X-rays. The Barbara says that she understands that the MRI doesn't pick up everything, but I can guarantee you the MRI picks up a lot more than the X-ray does. An MRI will pick up a lot more than the mammogram will. So this is that very important point, and I thank you for raising it. I thank you for raising it. This is very important information, and it's my hope that we are providing meaningful information for you. Meaningful information. Let's move forward because we've spent a lot of time on that. I'm going to try to see if we can cut back in about 20 minutes, but we're going to try to speed it up here a little bit. And I hope I don't get slammed by any authorities for sharing this information, but you know, at some point we have to stand up for the health of people. I already advised my family, so why not advise my patient family as well, right? Because I care about these. Well, Jai says the high level X-rays fracture the DNA strands. I do not know about that, but that's not so big of a concern per se, because we turn over cells. I would say, I don't know the exact number of cells we turn over every single day, but millions of cells will die every single day, and millions of cells will be replaced every single day. Your DNA is within the nucleus of a cell. So even if the X-rays will damage the DNA within some of the cells, those cells will become non-viable and will be replaced by the body. What creates the problem is not if it fractures the DNA, but is if it creates a mutation within the DNA. And I don't know of any study that shows that that does happen. And if I knew of a study that showed that that happens, or knew of any evidence that it does create mutations within the DNA strand, that's a whole other argument. And I would never, if I knew that to be true, ever recommend somebody to do a procedure that could change their DNA. So I'll say that. The benefit to doing a mammogram is simply that if you do have cancer in your breast that you have missed by whether self-exam, you might be able to catch it using the mammogram. So you will be able to detect a lot of breast cancers with the mammogram. But the mammogram is not sufficient because you still are going to have the cells typed to find out what's causing the abnormality, what type of cell it is that's causing it. So you still will have to probably do either a fine needle biopsy, or you will have to do a lumpectomy and have that tissue sent to the lab to be assessed. But one benefit of the mammograms is that it can detect cancer. But there's a cost to it, and the question is, which is greater, the benefit or the cost? And Jai says the less exposure you can have to all these x-rays outside the visual spectrum, the better. I agree 100%. And I even go further to say this. If you are a flight attendant or you are a pilot, you have to be even more careful about exposing yourself to further x-rays, because the x-rays that you're exposed to in the atmosphere is much greater at higher altitudes. We're not talking about altitudes that we can walk up a hill or walk up a mountain. We're talking about altitudes, the cruising altitudes of airlines. There's a lot of x-rays in the atmosphere at that high altitude because of the atmosphere's lack of protection at those higher levels. The lower you go in the atmosphere, the more protection the atmosphere offers you. And so if you're a pilot or you work in the airline industry or you fly very frequently, you have to be even more cautious about further exposures to any kind of x-rays or CT scans or mammograms or dental x-rays or any of those types of x-radiation. All those things that I mentioned are x-rays. So you have to be careful. So thank you, Jai, for all of that. Thank you so much for your input. That is very helpful. And all that you have shared is helpful information. And what I'm going to try to do is look up a little bit more about what you shared about the fracturing of the DNA, because I want to see what the consequences long term would be of fracturing the DNA using the x-rays. Because that would be important to know. Because I have not looked at that yet. So thank you for sharing. I really appreciate it. All right, so we're going to move forward here. So there are two ways that people think according to the illness model and the wellness model. And I'm going to move pretty quickly through this, so I'm not going to spend a lot of time. The pharmaceutical industry has taught us that if something hurts, we must take something for it. If we have a blemish on our skin, we must take something for it. Why? So that we can feel better or look better. We have an appearance of being better. Not to heal, but to appear better. So we say, if I have a problem, I want to just ask the question, what can I take in order to feel better? This is how the mindset is of somebody who is just about illness. But if you want to rise above just illness, rather than asking, what can I take to feel better? You can ask yourself the question, what do I need to do in order to get better? Because getting better is way, way, way more valuable than simply feeling better. In fact, there are many interventions out there that can help somebody to feel better without healing them at all. There are many interventions. For example, somebody has migraine headaches and they take something that blocks the pain pathways that lets you know that you're having the headaches. It blocks the pain, but the cause of the migraine persists. And I'll go into the mechanism of a migraine, but it's not so critical right now. The critical point is this: we want to ensure that we are focused on getting better, not simply just wanting to feel better temporarily. How about this? We often ask or offer gifts to persons, or we send well wishes to persons when they're in the hospital. And what do we oftentimes say? We will say stuff like, "Get well soon. I hope you get well." Because in our minds, we just want them to come back around. We want them to be back to themselves. But if wellness were like that, where we just wish for people to achieve it and they achieve it, then we wouldn't have been in the crisis right now we have in health. But wellness is not like that. Wellness is not about a destination to achieve. It is a journey to be on. It's not somewhere to arrive at. It's a journey. It's the process of wellness that is important. So rather than simply wanting to get well, how about we ask the question, what do I need to do in order to stay well? When you say get well, it's like a well wish. But when we say stay well, it changes how we even view the whole notion of achieving this wellness state. We view it not as a temporary thing to obtain, but as something that we have to do on an ongoing basis. It almost presupposes that we have to do something ongoingly in order to not just achieve, but also maintain. So staying well is a wellness concept, it's a wellness thought, not getting well. The last one is when we look at many people around us, they will use as their measuring stick of how healthy someone is or how well the system of our healthcare system is by how long people are living. How long people live is not an accurate or not the best indicator of the health of the population. It certainly has some correlation because by and large, most diseases are life limiting. And so, if you have a disease, chances are it's going to limit your life. But not every disease is life limiting. There are some diseases that just make living miserable, but they do not shorten your lifespan. However, if you are doing things to promote good health in your system, then chances are you're less likely to develop any of those diseases that will either be life limiting or life altering. So you typically will be able to live a better quality of life if you have a better quality lifestyle and make better choices for your health. So it's not about just simply staying alive now. We're talking about feeling alive, having that quality of life for which you are now excited, that you are able to appreciate the fullness of what life has to offer. Let me double check if the buffering is on my side. Somebody is having buffering issues. And the answer is no. It says that my connection is excellent. And let me see here. Let me look up here a little bit more for you. Yes, it says my connection and the stream content is excellent. So if it is buffering for you, what I'm going to ask you to do is look for the cogwheel. Let me see if I can show you what a cogwheel looks like. So you can um, let me look up the cogwheel icon. This is what the cogwheel icon looks like. This is the cogwheel icon. So oh, hold on. It's not visible to you yet. Hold on. There you are. That's what the cogwheel icon looks like. And this cogwheel icon is like a gear icon. If you go to YouTube, at the bottom of the page, or the bottom of the screen on YouTube, you can click on that gear icon and it will bring you to, it will show you different quality settings that you can use. Set that quality to either auto or set it to a lower number. The higher the number is the greater the chance of buffering. The higher the number is the greater the chance of buffering. So set it to a lower number like 360p or 240p. The image quality will be a little bit less, but it will allow you to be able to watch it without the buffering as much. So you can try that and see if it helps. All right. So that's for Barbara. That's for Barbara with the buffering issue. All right. So just to finally say, the difference between illness care mentality and wellness care mentality is not that great. It's a small, subtle shift. And anything in life is like that. When you want to have a change in your behavior, it's just a small shift in your mindset that creates a big change in your behavior. You're welcome for the tech lessons. And the change in behavior is simple. So watch carefully. In the illness way of thinking, it is feel better, get well, stay alive. But in the wellness mode of thinking, it is get better, stay well, feel alive. Feel, get, stay becomes get, stay, feel. And that subtle change is what makes all the difference. That subtle change is what makes all the difference. All right, so let's move on. This slide I can't skip by because it's so important. So I just go through it and I try to go through it quickly because time is against us. If there's anybody that needs to leave, let me know so that I can try to see if I can speed it up, right? But I'm gonna, I have a few more things to go through. It says key 2, but the first key was the longest one. But pain has a significant and very important purpose. It tells us that something is wrong and needs our attention. But there is a limitation to pain, and that is you cannot trust pain. And why is it that we cannot trust pain? Why is it that we cannot trust pain? We can't trust pain because it doesn't always tell us that something is wrong. In fact, as we were talking about cancers earlier, how many times have you heard somebody say something like, I found out that I had breast cancer because one night I was sleeping and a terrible pain in my breast woke me up that night. I went to the doctor, and when I did my MRI or my biopsy or my ultrasound or my mammogram or whatever, it said I had breast cancer. That's hardly ever the case. Most people, they find a lump in their breast or they feel something abnormal in the breast tissue and they go to their doctor, or the doctor examines them and during the course of the examination finds a lump or in their armpit. But here's what's interesting about whether it's a lymph node that's enlarged or a nodule in your breast that is abnormal or you're just now noticing it. When it is cancer, it is usually painless, meaning when you squeeze it, it doesn't elicit any pain. That is when you start to become concerned. Usually, if you squeeze a lymph node that's enlarged and it is painful or tender, usually it is not cancerous. Obviously, there are exceptions to every rule, but usually a painful lump is not a cancerous lump. The cancerous ones are usually painless. And so when I say you can't trust pain to tell you that something is wrong, in the case of cancer, you can have cancer for several years until it gets to the advanced stage before pain even starts to be a feature. So you can't just simply rely on pain to tell you what's going on. Good health doesn't mean you're feeling good, or feeling good doesn't mean you have good health. People need to understand that. Feeling good does not mean you have good health. If you want to know if you have good health, you have to test the function of your body. Good health means healthy function. You have to check your function or do things that promote good function of your body. What are some of those things? Well, I'm going to talk about that in a second, but the important takeaway is trust function, not feeling. Not because you don't have any pain, not because everything feels good means that you're doing well. You have to check. Now, yes, symptoms are a part of disease, but not every disease comes with an obvious symptom right away. And so don't just wait for symptoms to tell you that something is off. Now, there are several systems of the body, but it doesn't matter what the system is. And if you're interested in knowing all the systems of the body, feel free to just look at it right here. And so, if you want to see the systems of the body, the different systems are the immune system, the digestive system, cardiovascular, integumentary, respiratory, endocrine, reproductive, excretory, musculoskeletal, and the nervous system. These are the different systems of the body, and these systems are the ones that we have to be mindful of. These systems we have to be mindful of. Now, if we take care of each of the systems of our body, we have a good chance of achieving optimal health. But how do we take care of all these systems of our body? Because it's hard to go in and say, all right, I need to take care of my digestive system, I need to take care of my heart, I need to take care of my integument. Your integumentary system is your skin and all the coverings in your body. Your respiratory system, your endocrine, which is your hormonal system. How do you take care of all these systems? Well, we take care of all these systems by ensuring that we are eating the things that are required to promote the health of these systems while avoiding the toxins that we know will impact those systems. And the good thing is that now we have a good idea of the things that are good for us and things that are not so good. And so when we look at it here, we will see something like, for the immune system, what are some things that we already know are good for the immune system? Well, there are some vitamins and minerals that we know are good for the immune system. There are some people that will say something like, a vaccine is good for the immune system. How do I say this gently? A vaccine is very toxic to the immune system. That's as gently as I can express it. Why is a vaccine toxic to the immune system? Because it circumvents the way the immune system was designed to work. How is the immune system designed to work? There are two arms of our immune system, and the two arms work together. I think I need to make my screen a little bigger here because this one requires a little bit more a little bit more up close and personal. Our immune system works on there are two divisions to our immune system. One is called our innate immunity, which is our first line of defense, if you will. And the other one is called our adaptive immunity. Innate immunity, adaptive immunity. Immune system 1, immune system 2. Immune system 1, after it becomes activated, it triggers immune system 2 to become activated and do its job, which is to remember what it is that immune system 1 attacked. Immune system 1 doesn't work based on recognition of what the element is. It works on one simple recognition. Is this self or is this not self? Is this me or is this not me? Is this my cell or is this a foreign cell? Is this my protein or is this a foreign protein? That's all the innate immune system works on. In fact, our innate immune system is not just about recognizing things that invade us. Our innate immune system also protects us from anything coming in. The first line of defense is our behavior. That's our first line of defense in our immune system. Our behavior is a part of our immune response. In other words, we intuitively know that if something is dirty, we try to avoid putting it into our mouths. If we wipe our bottom we go to the toilet and we wipe, we know that we need to be washing the hands, right? Some people it's not so intuitive for them, but that's their own issue. But we also now have our skin as well as another layer of protection for us. And what the skin does, it creates a physical barrier from things that are outside of us from getting into us. But the skin is not perfect because there are things that can puncture the skin, like a gunshot wound, a knife wound, or some penetrating injury. Anything that punctures the skin gives opportunity for external elements, whether it's a bacterium or a virus or whatever, to enter our bodies. So the first line of defense is our skin. If our skin is healthy and intact, anything on the outside doesn't get inside. So this whole idea of washing our hands repeatedly, let's talk about that briefly. I'm going to tell you from now. Those who have the handouts, skip ahead. Maybe we'll get to finishing it at some other time, but at least you'll have that to look at. I'm not going to complete the regular scheduled class today because we're talking about some very important things. I don't want to just stop here. I need you to understand. When you puncture the skin, you give opportunity for external things to enter. When you wash your hands repeatedly, we have oils that are naturally secreted on our skin. When we constantly expose these oils to either surfactants or things like soap, things like alcohol, things like sanitizers, they destroy the natural oils in our skin, and that's why your hand get dry. When you damage the oils in your skin, your skin becomes more vulnerable to tearing. So you get cracks in your skin easier. If you get cracks in your skin, then things can now, if you expose your hands to something that can infect your bloodstream, like a bacterium, you can get that bacterium to enter into your bloodstream. So that's why it's important to keep our skin healthy. We cannot over sanitize, otherwise we're going to destroy the very important integrity of our skin. Second thing, our skin has on it what's considered to be a part of our natural biome, B-I-O-M-E, biome. Our natural biome is made up of bacteria primarily, but also viruses and fungi and different things that are on the surface of our skin all the time. It doesn't matter how much you bathe. It don't matter how many sanitizers you use. When you kill 99.99% of bacteria on your skin, you still have thousands of bacteria on your skin because there's millions and millions of bacteria. So 99.9% is still a whole heap of bacteria. You can't perfectly sanitize your hand. And that's why when a doctor is going to do surgery, they don't just do a wash one time. They do a triple wash. Then they don't just use their hands in the surgery. They put on these gloves. And not only do they put on a one glove, they probably double glove. and they put on the mask. The mask is not to protect them. The mask is to protect the surgical field from spit or whatever when they're talking and sharing, because their spit also contains bacteria and other things from inside your body that can get into the wound. So we have to keep the wound area clean. Why do we keep the wound clean? Because we have now cut through the person's skin and opened them up, so the primary line of defense is no longer there. So they're more susceptible to infection. So when you wash your hands, you get rid of your natural bacteria on your skin. Did you know that the natural bacteria on your skin protects you from the harmful bacteria? So much so that when harmful bacteria get onto your skin, the good bacteria will overpopulate it and dominate it and prevent it from infecting you. When viruses get onto your skin, the good bacteria overpopulate it, outcompete it, and prevent it from being able to infect you. Did you even know that? But when you are exposing yourself to certain specific types of pathogens, like the pathogens that exist in your gut, that you excrete from your behind, these bugs are harmful if they get back into your body through the other end, because it will mount a severe immune response. So when you go to the toilet, you wash your hands. When you're at the gym where a lot of people touch everything, wash your hands when you're finished with the gym. When you go and you spray everything that you're going to touch, let me tell you what you're doing. And I'm going to use this opportunity to do this now, because I have not had the forum to do it, and I've just been a little bit wary of doing it because I don't want people to come down hard on me. So now that the PM has withdrawn a lot of their madness from our land, apologize. A lot of the choices that they were making that impacts our health in a negative way to control the spread of an infection, which I understand why you'd want to do that, but the methods that they employed, some were actually very bad for us. So let's talk about the one called sanitizing. When you sanitize a surface, what you're doing is you're killing off all the vulnerable pathogens from the surface. Do you know which ones survive? The pathogens that survive are the stronger ones, or the ones that mutate to be able to resist whatever you're using to clean it. Now, if I'm cleaning my hand and a virus has mutated so that it no longer responds to the chemical I use to clean my hand, or a bacterium mutated and no longer responds to the bacterium, to the chemical I use to clean my hand, then that bacterium will now multiply. And every one of its offspring will have the same resistance to the same chemical. Do you know what ends up happening in hospitals because of the over sanitizing in hospitals? This is what's been the case, and this is why you don't ever want to get an infection in a hospital. It's because of what's known as resistant strains. You will get infected with a potentially resistant bacterium. Resistant bacteria do not respond to antibiotics. They're called superbugs or super germs. How did these super germs come about? They came about because of over sanitizing. Yes, over sanitizing is what creates the environment that currently exists in a hospital, whereby the worst possible place to get an infection right now is in a hospital. So why are we promoting that we create an environment whereby in everybody's home, in everybody's workplace, and in everybody's school environment, we are creating over sanitizing of surfaces, which will only naturally result in super bugs being dominant in the environment. Why is this a good idea? Maybe somebody can talk sense into me because that don't make no sense to me. And I don't understand why our medical community hasn't already come out and said that this is ludicrous. You can't sanitize surfaces. Because you keep sanitizing surfaces, you're going to create superbugs. So what you do is this. If you encounter a surface that you believe other people may have touched, wash your hand with warm soap and water, or soap and warm water. That's the best thing. But don't overwash your hands, because if you overwash your hands, you're going to destroy the integrity of your skin, which is going to leave you also vulnerable. So periodically wash your hands. Certainly be conscious of touching your face, because things can spread via your eyes, which is not covered by normal skin, your nose, which is a mucous membrane, and your mouth, which is also a mucous membrane. Your ears is not so much a mucous membrane till it's behind your eardrum. So it's not as easy to get an infection from your outer ear to travel inside. Not as easy that way. But it's possible. So these are things that are important to start to understand. Over sanitizing is dangerous. Anyhow, back to our immune system. We have white blood cells that attack anything that is foreign that comes into the body. It doesn't wait to identify whether it is COVID or it is dengue or if it is chickpea or whatever it is. It will attack anything that's foreign. After it attacks it, it chews it up and breaks it up into little tiny pieces, which it puts on the outside of its cells. These white blood cells that have now chewed up these things go and communicate with other cells of our bodies called B cells and T cells, which will interact with these proteins and make antibodies. Not only will it make antibodies, these antibodies will also now, well, before we get to the antibody stage, these cells that identify these proteins will become memory cells, and these memory cells will create antibodies that will attack the very protein that it made. So if a bacterium or a virus or something has 20 different proteins on it, when the white blood cells attack it, it will chew up the pieces, expose all 20 different proteins, and your body will make an antibody for each of the 20 proteins. Not only that, it will then also make what is called a memory cell. These memory cells go to two places to reside, either in your thymus or in your bone marrow. But some of these memory cells also reside in your lymph nodes as well, because the role of the memory cells is to make more antibodies. These memory cells, after the infection is long gone, they stay in your body forever until you die, for the most part, unless you have a compromised immune system. They provide long-term, lifelong immunity, because the next time something invades you, these memory cells are going to make more antibodies to fight the thing. It is not the antibodies that will stay in your body forever. It is the memory cells. Antibody levels go up and then they go down after the battle. So it's not about looking whether your antibody levels have waned. It is the memory cells that you're interested in. And this is how your immune system works. These memory cells do not become properly engaged unless it was first introduced by an antigen presenting cell from the first line of our immune system. So when you inject something directly into your bloodstream, whether it's a bacterium or a virus, whether it is the old vaccine types or whatever, when you inject something into your bloodstream and then your body mounts an attack against it, your body is using the humoral or adaptive immunity to attack it because it's already in your bloodstream. And by the time the antibodies are made, they are not quite as robust. But it is still far better to expose the body to the actual virus with all the proteins or the major proteins of the virus so that the body can identify all of it and make antibodies against all of it, memory cells against all of it to fight all of it. What I dislike about this current thing that they're pushing on the world, and I don't understand why our medical colleagues are not standing up and saying something, is that they're using one protein from the actual virus, which is called the spike protein. And when you expose the body to just the spike protein, then you're only making antibodies against the spike protein. There are over 20 different proteins for this particular virus. And if you're making antibodies to the spike protein, then what ends up happening is that if there's a mutation of the spike protein that changes the shape of the spike protein enough, then whatever antibodies your body made is no longer effective. And this is why the strains that we now see are proving or causing the I don't want to call the name, these solution attempts to be rendering them ineffective. And that's why people who have been vaccinated, boosted, and whatever, they're still coming down with the infection. Why? Because this particular strain has already changed enough from the original infection so that the original protein is changed that the body no longer recognizes it. So you get infected again. Why is it that those who have already been infected with the actual infection, with the actual original strain of the virus, and did not also get vaccinated, why is it that this person is not getting reinfected with any other strain? And don't tell me about, well, you can tell me, and I can explain to you why it doesn't mean anything, that they may test positive again. What you need to understand is that the test is not testing for infectivity or whether someone is infectious or infected. The test is simply testing for the presence of a strand of DNA or a sequence of RNA or DNA in the body. And when your body has already been exposed to it, there might be remnants of it still in your body that could still trigger a positive test on occasion, depending on how many cycles they run the test through, which they do not necessarily share with us. I know what the numbers are for Jamaica, what cycle threshold they use, and let's just say, based on what is used in Jamaica, the test that they're using to verify that somebody is positive is extremely flawed and leads to a very high percentage of false positivity, meaning that somebody who doesn't have anything is testing positive. And this is, rather than telling the truth to people, that the test is flawed and catching people who are not infected and saying that they're positive, they're saying this instead, and maybe you've heard it. They're saying that a large percentage of people who contract it are asymptomatic, meaning that they don't have symptoms. I have I have enough data to support what I'm saying because I have read the research myself. I'm not getting secondhand information from another person who claims to be an expert. When the expert says that this is the data that they use, I investigate the data that informed their decision. Because their decision, no matter how much expert they are, is based on data. And that data has to be accessible to the public, which I have reviewed a lot of the data. There's so much data that I can't possibly know everything, but I've reviewed enough of it to know what I'm talking about. It's a sad state of affairs, people, but it is what it is. I just try to advise those who I have in my circle of influence to kind of help you to not make bad decisions. But if you already make decisions that hurt you, um, it's just what it is. And you know, I feel badly for those who get injured, and there are a lot of people who have been injured. I have friends who have been injured. I have a lot of people who have been injured primarily because they they trusted the authorities. They trust the authorities. Sad, 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 sad. All right, let me just. I'm gonna try to see if I can skip ahead and just share just the next points here and see where we go, right? Of all the systems in our body, the nervous system is the master control system of the body, meaning that it governs and regulates the function of every other system. There's no other system of the body that is not under the direction of the nervous system. Whether it is through spinal nerves that go to the body or cranial nerves that go to the head and face, every system of the body has some control by the nervous system. And what are the gateways of the nervous system? Just to show you what the nervous system is. The gateways of the nervous system are our senses. What are our senses? Hearing, smelling, tasting, seeing, and feeling, or touch. There's actually another sense called proprioception, which is your body awareness in space. So it's not just five senses. There are more accurately, I think it's more like saying there are six senses. And the sixth sense is not ESP. It is proprioception. Body awareness in space. In other words, I can close my eyes and I know that my index finger is extended because the signal that's coming from the joints tell my brain that it's extended. Body awareness in space. It's not touching anything to let me know. It is not smelling, seeing, feeling, or tasting anything to let me know. It is the body having a map of everything it does to know what everything is doing. I can raise my arms, I can extend my arms, I can lower my arms, I can put my hands together, I can do all these things without being aware using any other senses what's going on because I have body awareness. So that's really the sixth sense. Students, if you're in school and the teachers ask you how many senses are there, if they taught you five, put back five as the answer. Don't tell them, say, Dr. Gardner said. Because that's not the answer they're looking for. You have to learn to give the teachers the answer that they're looking for, not always the truth. I say that tongue in cheek, but I know what I mean. Alright, so the nervous system controls the body. We access the nervous system through our senses. So if we see something, it goes into our brain and we have a thought or a response based on what we see. We also have a response based on what we hear, smell, taste, and so on. Did you realize that if somebody with a gun comes up and threatens you right now, and you see them, you don't even have to hear them, you just see them with the gun, it will change almost every aspect of your physiology. Your heart rate will change, your breathing will change, your sweating will change, your tension in your muscles will change. All these things will change. How does your brain control everything unless it has a way of communicating with everything? And it communicates with everything by way of your nervous system. So, going through, here's what we know. If you have a misalignment in the vertebra, that's between the bones here, it can affect the nerves that exit. And just to point out quickly that the nerves of the spine exit between the bones of the spine to carry the signal from the brain to the different parts of the body that it controls. And if it is that you have a misalignment of the spine, like this middle bone here is misplaced or displaced, it can close off the opening where the nerves exit. And this red one is a nerve that is being squeezed here. We call it a pinch nerve. It's squeezed because the disc has been, the bone has been displaced in the spine. The bones between the spine have an opening for the nerves to exit. And as they exit, they control different parts of the body. If you squeeze the nerve, whatever it controls no longer works the way it should. And this is when illness sets in. I'm about to close here, but I want to close on this, why we get sick. Because it's an important point, why we get sick. We get sick because of stress in our lives. And there are three types of stresses that we are primarily exposed to. Physical stress, like a fall, an accident, a gunshot wound, whatever it is. Biochemical stress, which is chemicals that we are exposed to. Toxins in our atmosphere, things that we eat or drink. These are biochemical stresses. And then psychological stress, which are the emotional things that impact us, whether it is a relationship at work with our boss that is very demanding, or deadlines that we have due, or projects that are backing up, or our business is falling apart, or our marriage is falling apart, and these are stressors to our system. Stressors will cause our bodies to break down or change. It changes our body from being in a state of harmony or homeostasis to a state of dis-ease. So homeostasis means that we're at ease, we're at rest. But these things will cause us to have dis-ease. After we have been in a state of dis-ease for long enough, then that dis-ease will eventually lead to a disease. This is why we get sick. So I'm going to show you a description here to help you to understand using an analogy called a gap analogy, where the gap is what we call our general adaptive potential, because our ability to adapt is what determines our ability to stay healthy. If we can't adapt to changes in our environment, that's when we break down, that's when we get sick. So I'm going to use our adaptive potential to explain it, and using a gap as the analogy to explain how this works. Every gap has a lower limit, and it will by extension have an upper limit. The space between the two represents the gap. If the upper limit gets wider still, we consider that vitality. The higher up it goes, the healthier we are, because the gap is wider. The healthier we are approaching vitality or optimal health. If the upper limit starts to fall, then the gap becomes narrower and we are approaching death. Where at the bottom of the gap represents death. Environmental stresses or external stresses push down on our upper limit and will be the opposing force to our ability to remain healthy. The only thing that we have is our internal resistance to oppose the external forces of our environment pushing down on us. If our internal resistance is high enough, then we can overpower the external stresses and our gap remains wide. We remain healthy. But the moment our internal resistance falls below the stresses that we are exposed to, we are no longer able to adapt as well, and our gap narrows. What we hope for is that our life experiences exist within the boundaries of our gap. And if all our experiences of life are within the boundaries of our gap, We do not break down. We do not get sick. We do not falter because anything that happens to us, we adapt to it. But what, say, for argument's sake, will happen if now, instead of having a good wide gap, our resistance falls and our external stresses now overpower our resistance and our gap starts to narrow? What happens? Then our potential is lowered, and at some points in our lives, there might be an experience that now exceeds our ability to adapt. For some families, they are more vulnerable at cancers, so we might develop a cancer. Or some people have diabetes or hypertension in their families, and so we are more vulnerable there. And so if we allow our resistance to fall, we may develop those illnesses. But not because your parents and your siblings all had breast cancer means you must have it too. But if you live according to the lifestyle that they lived and are exposed to similar kinds of stressors, chances are you two are going to develop it. So if they have it, it is more of a necessity for you to live in a way that's completely different from them. It means making hard choices. Being healthy is not about making easy choices, because convenience always comes at the expense of health. Almost always. Convenience almost always comes at the expense of health. Microwaves. These things are convenient but very unhealthy. I wish I had the time to do different talks on different things like microwaves and so on. I'd rather do that here online rather than on our radio program. I don't know if there are any microwave companies there, but there are many issues with microwaves. But if you have a microwave in your home and you have not yet thrown it away, as I have, what I would suggest that you do is this. Take your microwave and ensure that whenever you're cooking anything in your microwave, at least make sure that you're using glass or stoneware in your microwave, not plastics. Do not ever put plastics in a microwave because the chemicals in the plastics will break down in the microwave and adhere itself or absorb itself into the foods that you're eating. So don't use plastic in your microwave. Use glass, like a glassware. Look at it, make sure it says microwavable or microwave safe, or stoneware, ceramic plates, not plastic plates. A glass or a ceramic mug, not a plastic cup or anything like that. All right? Hopefully that helps. So we've spent a lot of time today talking about many things. And I'm gonna, in a moment, just close off the evening because we spent a lot of time. Suffice it to say, chiropractors, we realign the spine, and by realigning the spine, it improves the function of the nervous system, which can help widen our gaps. But having chiropractic care alone is not all that is needed to widen your gap. You have to have a healthy lifestyle. It's a lifestyle choice. Chiropractic is just one small piece of the pie. You need other elements that have to be a part of it as well to get the most out of health. Chiropractic is just one small part. So, for those of you who are joining us here, let me just share that as we end tonight, at our practice, we have a vision here. There are threefold. One is to identify these misalignments, we call them subluxations, throughout the body by using our specialized technology or examination process. This will let us know how likely it is for chiropractic care to be of benefit to you. Second thing is that we provide a program of chiropractic care to everyone who we believe could benefit. A program of care might be 12 sessions. It depends on the individual. But generally, we start off with 12 sessions and we go in 12 session increments to get the person back to optimal health. I know there's one objection for chiropractic that says once you go to a chiropractor, you're going to always have to go. Let me ask you this. And the answer is yes, that's true. If, not completely true, there's an if here. You will always have to go to a chiropractor if it is your desire to maintain your spine in its optimal health. If your desire is to obtain optimal health for your spine and maintain it, then you have to go to somebody who's going to help you to do that. A chiropractor is one professional that can help you to do that. Not the only one, but one. If you have a car and you service your vehicle, why don't you ask yourself the question, how long do I have to keep servicing my car for? When you're servicing your vehicle, do you take it to the garage and the garage says, okay, this is going to be your last service. You don't need to do any more servicing after today because your car is now good. As long as you're driving on our roads, especially our Jamaican roads, which are very rough, you're going to need to ensure that you're servicing your vehicle on a regular basis, at least as scheduled. Otherwise, your car is going to break down. And when you're looking at your body and you're sitting in these uncomfortable positions, lifting, bending, turning, sweeping, mopping, doing all these things that are so stressful on our spines, don't you think that you need to periodically get your spine looked at or at least realigned? Because I can guarantee you, almost everybody listening right now has misalignments in their spine that could benefit from chiropractic care. So when you understand the context, it makes sense, right? So chiropractors are really here to help maintain your spine in optimal health. You do that as long as you have your spines and as long as you want to do that. You don't do it until your symptoms are gone and then you stop and just do your own thing. How long do you go to your dentist? You go as long as you have teeth. How long do you go to your chiropractor? You go as long as you have a spine. Full stop. I hope that helps. And the third aspect of what we do is to educate our community to ensure that you have enough information to make wise choices for your health. People make poor choices for their health, not because they want to make poor choices. They make poor choices because they are being led down a path of limited information, so they can't make an informed decision for their health. You are responsible for your health. Nobody else is responsible for your health. You are responsible for your health and well-being. So the key to success in getting and staying well is for you to take responsibility for your own health and well-being. Nobody else can be responsible for your health. You have to be responsible. Your doctor is not responsible for your health. Your doctor has other priorities. You are not their priority. You are one of their patients. Their priority might be to help you get better, but you are not their priority. They are their own priorities. You are your priority. Make sure that you make wise choices. Do not make poor choices for your health. And sometimes well-intentioned people, even myself, I might make a recommendation that's not the best thing for the patient. Though I might think that it is, it might turn out not to be. There's somebody that I saw recently, a patient of ours, who had a situation that was so serious that I knew that if we did our chiropractic care on the person, there was a very high likelihood that they were going to become worse off from the treatment. So I referred that person out because it was a situation that required surgery. The person did the surgery and the surgery did not go well, and the person is currently worse off having done the surgery. I feel terribly about that because I made the recommendation. Although I know it was in their best interest, in the end, because of how it happened, the person would have been better off if they had not done the surgery. But there are many more that we have referred for surgeries in similar situations, and it went well, and they have been significantly benefited from it. So this is not a bash against surgery. This is that I make recommendations sometimes that do not work out in the best interest for the patient, but I do what I can to make the best choice clinically for them. But you have to not relinquish all of the responsibility to your doctors and just do as your doctors say. Your doctor is not your patient. Your doctor is not in charge of your health. Your doctor is only here to guide you to make the right choice or the best choice to restore your health. Your doctor is not in charge. You are in charge of your health. So the final decision has to be yours. Not through coercion, not through any other means. The final decision is yours. So we have on our page testimonials. So feel free, after we've closed here tonight, to just revisit our testimonial page and see if there are any testimonies that you like. I have a few on here. I've stopped putting any on there because people really enjoy them, and my office is already inundated with folks, so much so that it takes too long for people to get an appointment. And until I can get some assistance, and if you know anybody who wants to practice in Jamaica, you know, I'll put our email address in. You can just even send a message in this chat or what have you, or Google us online and send us a WhatsApp or send us a Gmail or GCN Jamaica.com is our website, www.gcnjamaica.com. And you can find our details on that website as well. You can email us at care, C-A-R-E, at gcnjamaica.com. Jamaica is spelled out, of course. So gcnjamaica.com. So that's how you can get a hold of us. You know, anyone who is looking to practice in Jamaica, we'll talk to them. But you know what? I'm going to have to vet them to make sure that they are of a quality that I would be comfortable having my mother go to. Otherwise, I'll go on Pel and Bata by myself till we find somebody, right? But I want to make sure that it's good quality people. So once you see somebody with us, you know that this person is trained and is properly qualified to do what they're doing. So I have a special offer. We're at the end. I have a very special offer for anyone who is not currently a patient of ours, but thinks that they might want to become a patient. I have a very special offer. Obviously, you're not going to exchange any money now, right? You're not interested in anything like that. But if you're interested, you have to just let us know by sending us an email, and I'll set the email address. The email address that you'll send it to is appointments at gcnjamaica.com. If you want to make an appointment to see us, send an email to appointments at gcnjamaica.com and let them know that you watched us online and you want to make an appointment to see us. You will receive a 40% discount off your new patient examination just by being a part of this session. So make sure you send off that request via email, and we will know that you paid that you were part of this by your submitting your name in the chat. So if you have not yet put your name in the chat, please do so now so that we can know to send you wherever wherever, you know, whenever you tune in. If you put your name in the chat, we'll know that you tuned in and we'll use that as a register to confirm your attendance to the class. But if you did not attend the lecture and you did not listen to the lecture, you did not put your name in the chat, you will not qualify for this discount. The next thing is, for those of you who are existing patients, you will get more. You'll get a 20% discount off your update examination, which is almost the price of the new patient exam. So it's 20% off. You'll also get 20% discount off one treatment for every one person that you refer. So if you refer one person, you get 20% off one treatment. If you refer two people, you get 20% off two treatments. That's correct. And so on. Or you could opt to get the two 20% off the same treatment. It doesn't matter, it's the same amount of money. And so if you refer five people, you get a free treatment. So the way we look at it is we want to make sure that people who come to us, we reward those who help us to grow, so to speak. So if you tell somebody about us and you send them here, just make sure that they have your name, because once you give them your name, then they will get 20% discount off a new patient exam, even if they're not on this thing. Anybody that you talk to and you say, go to Dr. Gardner, tell them my name, they will automatically get a 20% discount. And not only that, you will also get a 20% discount, but not off an exam, off one treatment for every person that you refer. So I hope that is clear. And after you're finished with your phase of treatments, we do an update exam and scan. That's what you're gonna get your 20% discount off. But following that update examination, if more treatments are needed or recommended, then you will also get a 10%, a further 10% discount off your entire next phase of care. That is 12 treatments plus an update exam. You'll get 10% discount off all of that. And just that one line item alone is more dollars saved than the 40% for the new patient of the exam. So I hope that is clear. Wow. I'm going to give a couple more minutes just to allow you guys to ask any questions if you have any questions. But if you want to find us, this is how you find us online, on Facebook, on YouTube. And we also have a radio program that we have every Tuesday night at 8 p.m. Jamaica time called Back to Health. So you can find us on Facebook. We stream live on Facebook at Back to Health Talk Show. So go to Facebook and type in Back to Health Talk Show, this bottom link right here, and you should be able to join us. It was such an intense pleasure getting to see you all. May God bless you and keep you, and grant you his favor. I am grateful that you are able to join us. Take care of yourselves, and we shall see you soon. Have a great night, everyone. Take care.
starting to light up, yeah. And your heart is out of sight. I just wanna feel mine. Hey you, I'm gonna be the one for another one. Hey you, maybe then you'll know that I was never one. I don't wanna see you, I don't wanna fear you tonight. You don't wanna know me, you just wanna make sure